Hi folks, my name is Professor Steve Case and I'm Head of the Social and Policy Studies Unit at Loughborough, which comprises the Criminology and the Sociology degrees. I'm going to give you a taster lecture now on kinds of things we talk about on Criminology degree, which is also accessible to the Sociology students. We talk about how to solve the supposed youth knife crime problem with a principled model of youth justice that I've created through my research, which is called Children First. There are also a few other videos on YouTube that you might want to look at that I've done, linked to my criminology textbook. One is called Studying Criminology, another is called What is Crime, and there's one called Solving the Youth Crime Problem as well, which is a TEDx talk. So if you're interested in criminology or criminological issues, have a look at those. So, the youth knife crime problem, which up until the recent coronavirus outbreak was considered to be a big social issue, a really pressing social issue. What I'm going to talk about in this little taster session, which would normally go for 2 hours really, and we'd have discussion, but I'm going to talk about the context of knife crime committed by children and young people in England and Wales. I'm going to talk about the supposed causes of youth knife crime and how there's a kind of a really significant debate to be had around what causes youth knife crime, and how we should respond to youth knife crimes. I'm going to talk about government responses and strategies, policies and practices. I'm going to talk about an emerging public health model manner of responding to youth crime, which is becoming increasingly popular in local authority areas. And I'm going to talk about my Children First approach and how that can be an antidote to dealing with offending by children and young people, including knife crime. So, what's the context of youth knife crime? Is it really a significant problem? What do the statistics say? Well, it is an issue, it is a social problem, but it isn't as significant as the media or politicians or even some researchers would have you believe. The statistics show that only 20% of those cautioned or convicted for knife crimes are what we call children and young people, or youth offenders, 10 to 17-year-olds. The stats from the Ministry of Justice, or annual stats, also show that knife crimes are falling. But what they also do show is that the majority of knife crimes that are committed by children and young people take place around schools. And there has been an increase in the number of children and young people who've been victims of knife crime as measured by hospital stats. So, again, this is a problem, this is an issue, and interestingly, it's an issue, knife crime is a particular issue in terms of young people's victimisation. They are disproportionately likely, more likely than other groups, to be victims of knife crime. But the extent of knife crime, the amount of knife crime, the proportion committed by children and young people is much lower than you might be led to believe by the media and politicians. And here's an example of a media, what we call a moral panic in criminology and sociology, how the media try to inflate and exaggerate the extent, the amount and the nature, the type of youth crime in the UK by using these inflammatory terms: Wild West Britain, epidemic. This is from the Daily Mail, which is of course a very untrustworthy anti-child media source, if you like. Causality is really, really interesting around knife crime. So what do we think the causes of youth knife crime might be, or knife crime in general? And we discussed these in seminars on the criminology programme. Typically, the causes of youth crime, and knife crime in particular, have been linked to what we call risk factors, factors that increase its likelihood if children are exposed to them. And risk factors, or causes, tend to be located in actually three main areas. Within the individual, as you see there, so kind of psychological, emotional, cognitive, genetic, biological. Within the family and the school, within the community. There's also a group of risk factors that are located within society. as you see unemployment, poverty, homelessness, etc. But what tends to happen with media, political and academic explanations of knife crime amongst young people, they tend to be located within the individual or their immediate social environment, what we call psychosocial factors, so psychological factors, immediate social factors in the family and the neighbourhood and the school. And what that tends to do is individualise the causes of youth knife crime and imply that a child or a young person is somehow to blame for being exposed to these factors, and somehow is to blame for not being able to resist or negotiate these factors. So it holds children and young people increasingly responsible for their offending behaviour, when really many of the most significant causes of particularly serious and violent crime may well be external to that child and very, very difficult for them to resist or negotiate, such as located in society, or the effects of other people, or them being put into dangerous criminal situations. And so the risk factor approach, the risk factor paradigm as we call it, has a particularly problematic way of viewing children and young people, in my view, and their offending behaviour, because it presents them as though they are broken, as though they're full of what we call deficits, weaknesses, flaws that need to be corrected and treated. And that leads into an understanding of youth knife crime and youth offending more generally as being some kind of disease or medical problem or epidemic that needs to be treated by adults, when really, as I'll go on to argue, many of the more significant causes of youth knife crime could be located outside of the individual, could really be the fault of adults, could really be social factors created by governments, created by local authorities, that are inflicted on children. That's the kind of discussion that we tend to have in our team, because we're very interested in social justice issues, we're very interested in research and theory around vulnerable groups, around children, young people and families, around inequalities, around discrimination, things like that. So, what could some of the other external causes of youth knife crime be that aren't located within the individual, that aren't the broken individual, the damaged individual, the angry, dangerous child, the psychological disorder? What could these causes inflicted on a child or a young person from outside be? So austerity. These rampant kind of economic cuts to services, cuts to support, children's services, youth centres, supportive policing. Austerity measures have had a, as I say, disproportionately damaging effect on children and young people, because the support services have been cut to pieces. And so children who have problems in their lives, problematic experiences, who might be suffering abuse or neglect or bullying or educational or social disadvantage or social exclusion, or live in neighbourhoods where there's not much to do, or be in what we call criminal peer groups, got nowhere to go. They've got no support, guidance, advice, alternatives, because these are being stripped away by economic austerity. It can be argued that kids and children's services, they're the first to be cut, because children and young people have the least voice in society, the least power. You know, that's the kind of argument that I would make. Toxic environments. So adults being politicians, local politicians, what we call key stakeholders, service providers, media, academics, teachers, etc., can create toxic environments around children, in their homes, parents, in the schools, in the neighbourhoods. Toxic, dangerous, poisonous, harmful environments, especially in socially disadvantaged neighbourhoods with very, very limited resources or money, And this can result in the children that live in these neighbourhoods, live in these environments, being scared, being what we call disaffected, so zoning out, disengaging, being provoked or motivated into protecting themselves, or being violent, or being vengeful. It's no surprise, if you think about it, that the vast majority of knife crime are committed by children and adults takes place in neighbourhoods that are socially disadvantaged and suffering from a lot of disinvestment, which are toxic, which are breeding grounds for violent and serious crime, where there are no jobs, where the educational provision is poor, where there's lots of family breakup, where there's criminal peer groups, where there's a lot of drugs, where there's not a lot of alternative constructive activities. And that's the flip side of this risk factor argument. This is, rather than blaming children for committing knife crime because of problems within themselves that they should be able to resist, we're looking outside to examine what are the kind of influences that adults inflict upon children that can make knife crime seem a viable option. The only option. Victim status, really, really important. I said right at the start, children are disproportionately likely to be victims of crime, of knife crime in general, actually. And if a child's afraid of being a victim, there's quite a lot of research around suggesting that kids carry knives to avoid becoming victims. And what you've got there, you get into a vicious circle where a child will carry a knife to protect themselves from maybe other children, maybe from adults, maybe from grooming, from this county lines drugs activity, from being targeted by gangs. Yet they'll be caught in possession of these knives or using these knives, and they become another knife crime statistic. So you have a vicious circle, really, and the knife crime problem therefore gets worse. But this is very much neglected in a lot of discussion around children's offending, that they are so likely to be victims, that offending may be the product of their victim statement, of their fear of becoming victims. And that again is toxic. We've got the influence of social media, the increasing influence of gangs. These are really academic theories about why young people are being led into knife crime, because the glamorisation of weapons on social media, through drill music, glamorisation of violence, recruitment of children into county lines activities. County lines activities are where kids are recruited by criminal gangs into drug running activities across different county borders, going into different counties to pick up drugs, to sell drugs, etc., because they are so vulnerable and they can't protect themselves from this kind of level of exploitation. And the only way they can protect themselves is maybe by carrying knives. Again, so you have a self-fulfilling prophecy, or you have a vicious circle, if you like. So that's another set of external influences on children's so-called choice to commit knife crime. And the police have a very, very important role in potentially causing, but also potentially preventing, knife crime. There's lots of research around focusing on the role of the police, focusing on police activities as influencing, what we call exacerbating, making worse, knife crime in different areas through discriminatory policing, through a lack of trust in the police amongst children and young people, so they don't report knife crime, they don't feel protected, so they carry knives to protect themselves, through feelings that the police don't detect knife crime, through arguments that discriminatory stop and search is targeted on particular groups leads to them showing up more frequently in knife crime stats. And we're talking about children and young people as a discriminated against group, as well as black and minority ethnic young men there's an argument there that you're more likely to become an offending statistic if you are stopped and searched. And if you're more likely to be stopped and searched, that feeds the crime statistics, as well as a reality about why you're actually carrying these knives in the first place. You're more likely to be detected if you're in a particular group, and therefore you're more likely to present as a problem. That group presents as a problem group, then they are more likely again to be stopped and searched, and the problem increases and increases and increases. And that becomes a self-fulfilling prophecy too. And the problem certainly in these socially disadvantaged neighbourhoods, dangerous neighbourhoods, is that the relationship between the police and the community has become fractured because of policing practices or because of public perceptions of the police. And so the knife crime problem spirals out of control. So the police have a very important role to play. So let's have a look at some of the government responses to knife crime more generally, and youth crime, knife crime particularly. Typical government responses have tended to be what we call punitive, based on punishment. So they've been about tougher policing, they've been about restriction and control and management. So the knife crime prevention orders that are placed on kids over 12 years old caught with knives that are very, very restrictive and very, very punitive. Curfews, social media restrictions, convictions and prison sentences. And my colleague Joe Deacon, Professor Joe Deacon, talked about these particular government measures when Sajid Javid was the Home Secretary, which was only a year ago now, by saying that the proposals for knife crime prevention orders, tougher policing, tougher sentencing aimed at children and young people convicted of knife crime are flawed, because you can't prevent violence by identifying and punishing those identified as at risk of offending. Go back to our risk factors, causes at the start of this presentation. And if you stigmatise young people as risky, it draws them into conflict with the authorities. So, for example, police in their community, they become over-policed, over-surveilled, so they're watched too much. They become vengeful, resentful, disengaged from the police. The police are more likely to stop and search them, to discriminate against them. They're more likely to show up in the crime statistics. They're more likely to take matters into their own hands, etc., etc., etc. So these punitive measures, can be counterproductive. They can result in children and young people becoming very disaffected, very angry, very vengeful, very scared, which has a knock-on effect into knife crime, rather than reporting to the police, feeling protected by the police and other adults in their community, going to support services, etc., etc. There are other government strategies as well, looking into preventing youth knife crime. There's a serious violence strategy aiming to break the deadly cycle of violence, and that's more than just enforcement and punitive measures. There's some early intervention in there, there's some rehabilitation in there, there's some treatment of knife crime offenders. And there's also talk about supporting communities in there as well, and early intervention and prevention to support individuals. So it's a little bit more about a supportive approach as well, because it's become increasingly clear that we can't police our way out of knife crime. It makes the situation worse, because the causes of knife crime amongst young people are much more complex than just an individual choice, or than just about gangs or drugs. They're much more complex than that, and you need to address the causes in order to prevent the behaviour. And so there's an increasing acknowledgement of that within government responses, that we shouldn't be solely focused on law enforcement. We should develop partnership with a number of support services around children and young people: health, social services, youth offending services, victim services, etc., etc. It makes much more sense to have what we call a holistic approach, a whole child comprehensive approach to address the whole range of problems that could potentially contribute to knife crime. Again, those are the kind of things we discuss in our lectures and in our seminars. Now, the public health model is a particularly modern and increasingly popular approach that acknowledges that knife crime is complex, that it's a mixture of individual, immediate social, community and kind of broader social factors and influences. So the public health model takes knife crime, youth knife crime, as a health issue and suggests that we should tackle all of the causes of youth knife crime, including the social determinants like inequality, like disadvantage, like poverty. That everybody in a community should take responsibility. It shouldn't be treated as though it's necessarily a disease that requires clinical interventions, medical treatment if you like, that we should have community and social interventions that are available to everybody, that we shouldn't just target these on high-risk populations, so-called high-risk populations such as children and young people. And we should have a whole system approach rather than just making this an issue for criminal justice, because if you do that, it suggests again that children and young people, that offenders as a label, are entirely to blame, entirely responsible for their behaviour, and it couldn't possibly have been influenced by any other external factors that also need to be addressed and treated. However, the public health model has fallen into the risk factor trap in a lot of local authority areas. The governments and local authorities, councils are very keen on the public health model because it looks holistic, it looks comprehensive, but it's tended to marginalise children. It's tended to still continue to understand knife crime in what we call an epidemiological way. In other words, in terms of a disease that we need to find the causes of in order to treat them in a medical way. So it's still kind of classed as a disease, as a pathology, an illness that needs to be treated through medical interventions, individualised interventions focused on the child and their thinking and their psychology and their emotions and their choices, solely focused. It's not to say that these aren't issues, these aren't factors, but they can't possibly be the only influences, as we've discussed, can't be the only influences on children's knife crime behaviour. Why do children choose to commit knife crime? Why are children in social situations that make them more likely to commit knife crime? Why do they feel that they need to commit knife crime? What's happened in their lives and who's responsible for it? It can't be a product solely of what we call psychosocial, psychological and immediate social, family, educational, neighbourhood risk factors. Knife crime cannot solely be the product of a broken child who needs to be fixed by an adult. It can't be. This is far too negative, this is far too deficit based, this is far too narrow, far too what we call reductionist. It's too restricted a view. Yes, we should treat those issues, yes, but we should even think about those individualised issues in a much broader way. How have they happened? Why have they happened? And what needs to be treated? What needs to be addressed in order to make sure that they don't continue to influence the child's behaviour? So the child first approach that I've created with my colleague Kevin Haynes, which is now the national strategy for youth justice in England and Wales, it is very, very simple. It flips our thinking, our established thinking on its head, and says we should consider the child first and the offender second, or the offender not at all, really. These are children committing offences with complex lives, but they are children in their thoughts and their feelings and their capacity to take responsibility and their cognitive thinking ability and their relative lack of power in society. They should be treated or responded to as children, first of all. In the short term and in the long term, they shouldn't be punished as first resort. They should be supported, they should be helped, they should be guided. Punitive measures, criminal justice measures, are very, very short-sighted and unsustainable. They've been shown historically not to work very well in isolation. We need to put supportive measures around the child so that they don't, not influenced by the causes in the future. It makes perfect sense. We should give children access to support services, to guidance, to opportunities. We should try to promote positive and what we call pro-social behaviours and positive behaviours and outcomes for the child. We should see knife crime and other offending as a kind of a cry for help almost, as a flag, as an indicator that that child is experiencing a host of problems, often outside of the criminal justice system, that need to be addressed, that that child has got a series of needs in their personal life, health, well-being, mental health, psychological, family, social care, educational, in the community, needs that probably haven't been addressed by support services for a variety of reasons. We need to put this support around the child. And we need to tackle broader social exclusions, social inequalities in communities, in neighbourhoods, that are creating these toxic environments around the child where they have very limited opportunities, where they are put in danger, where they feel vulnerable. So the lens, the view, is on the child first. We're considering the issue from the child's perspective. We're looking at the child, we're not looking at the offence. The offence is a product of a whole host of problems, experiences and unmet needs in the child's life and influences on the child's life. They're the things that need to be addressed. That's what Child First does, Children First. We need to tackle these toxic environments. So again, my colleague Alexandra Cox, I'll leave you with a bit of time to have a look at that quote. But what she's basically saying is there are a whole host of factors external to the child that the child's got absolutely no influence over, but that influence the child's behaviour, that influence the contexts and situations in which the child lives, the opportunities and support given to that child. They all shape children's lives, and we need to address these broader factors in order to shape children's lives in positive ways, so that we can help children who do commit knife crime, and we can prevent children from committing knife crime. So just to finish up, this is my approach, my recommended model of youth justice for dealing with offending by children, including youth knife crime. Focusing primarily on the child, as a child, focusing on social structural factors, social disadvantage, poverty, unemployment, neighbourhood degeneration, all these kinds of toxic environmental factors that influence the lives of a child. Communities taking responsibility, adults taking responsibility for promoting positive behaviours and outcomes for children. Diverting children from formal youth justice services and into more appropriate support services, where they're not criminalised, where they're not labelled, where they're not considered to be dangerous or threatening, where they're considered to be children who are otherwise in need, with problematic experiences and need of support. That we talk to children, that we involve children in planning and delivering the services that we give them to support them. That's really, really important too. Children have a voice. Children know their own lives better than anybody. Why don't we talk to them? Why do we do youth justice to them rather than with them? And that children are part of the solution to these problems. They're not part of the problem. They shouldn't be what we call stigmatised or labelled. The problem is much more complex, much broader than it's presented in the media by politicians, because they have particular agendas to simplify and to blame and to distract attention from their own responsibility in creating and addressing some of these factors that influence the behaviour of individuals in society. These are the kinds of discussions that we have in our criminology programme at Loughborough, should I say. And I hope that you'd find that very, very stimulating and interesting. We address these really live, important social problems. We have a very big emphasis on the social policies and strategies and laws that result from research and debate around these series of social problems across our degree programmes. So this is a very real, high impact type of degree. We try to bring criminological and social policy issues alive for you. I hope I've in some way given you an introduction to that kind of thinking. So many thanks for listening. If you have any more questions, please get in touch with us, and I hope to see you soon.